Salt is often called the heart of every dish. But for patients with hypertension, it's also the heart of many concerns. How much is too much? We all need to know. Let's turn to an expert for clarity regarding ideal salt intake for managing hypertension.
Good morning, Mr. Ronit. My name is Dr. Ankur Raval. I am consultant physician and clinical diabetologist at Khambat Dr. Ankur Raval Hospital. I am also attached to Spandan Multi-Speciality Hospital. I am with ONGC panel and working as a diabetologist at Kembe Cardiac Care Center. Answering to your question about the salt intake, you rightly pointed out the salt always adds the taste to the food, but it may not be beneficial for our patients. Just to answer your question in a crispy way, like salt restriction means 5 grams of salt, that is common salt, is allowed per day. Salt free diet means 2 gram of the salt is allowed. Average consumption of Indian patient is to the tune of 17 to 18 gram. It may be 23 to 24 gram per day in adolescents who are taking pizza, pasta, puff, and wafers. So this much is the salt consumption in Indian patients. We Gujarati are also fond of the tasty food, but the recommended salt intake per day is only the 5 gram per day, mainly to achieve our BP goal. Thank you.
Thank you, doctor. Your expert advice will empower patients to strike the right balance, savor their meals, and successfully get to goal for healthier blood pressure. One of my relatives has high blood pressure, but tracks it diligently twice a day, keeping a record to stay in control. While some friends tease him, it raises the key question: how crucial is regular BP monitoring? And what's the best way to do it at home? Doctor, please, could you share your expert insights?
Yes, Mr. Ronit. Uh, BP monitoring is a cardinal part of the blood pressure control. Home blood pressure monitoring is really justifiable. The frequency depends on the patient's condition and everything. Usually, I am just advising my patients to do the home blood pressure monitoring. They have to chart their blood pressure with the time and with the date. And ideally, they should monitor the BP prior to taking their antihypertensive medicines. They should be in the relaxed mood. They should not smoke. They should not do any exercise, and they should be having a sort of say in a relaxed mood, with preferably in the chair, not with the cross leg. And BP monitoring, like many times our patients are panicky. They just go on measuring BP for many times. This is not required. Like according to your doctor's advice, like to some of my patients, I am just asking them 3 times in a week, or to some patients, I am just asking them 3 times in a day also. So that depends on the patient's blood pressure as well as the comorbidity. BP monitoring is always required. This is just to know whether you are able to achieve your goal day by day or not. So, home blood pressure monitoring is endorsed by WHO for the very good BP control. Thank you.
Thank you, doctor, for clarifying this important topic. Your guidance inspires patients to take control and confidently get to goal with their blood pressure targets. Exercise is often called the best medicine, but is it the same for hypertensive patients too? If yes, which type of exercises are recommended and which are to be avoided? It's so confusing. Let's ask our experts for insights on the role of exercise in managing high blood pressure and whether there are specific types or durations of exercise recommended for better control.
Yes, Mr. Ronit. Exercise is a trump card so far as the blood pressure control is concerned. In many of my presentation, I used to say in Gujarati, 40 પછી તું 40 મિનિટ 40 નહીં તો તું ક્યાંય 40 નહીં. I repeat for the benefit, 40 પછી તું 40 મિનિટ 40 નહીં તો તું ક્યાંય 40 નહીં. This is the importance of the exercise. To best of my knowledge, the walking is the simplest exercise. And of course, person can do the jogging, person can do the cycling, the swimming. I think the aerobic exercise is justifiable in the patients having the hypertension. Those patients who are having very high blood pressure, they should avoid the isometric exercise, because like it can cause more harm than the benefits. So exercise is always beneficial, and we should try to motivate the persons for the exercise. uh, Having said so, I must add, persons should avoid the smoking, persons should avoid tobacco in all form, tobacco in all form. They should avoid alcohol as well. So the exercise with the lifestyle modification and cutting their habits is usually beneficial for the patients achieving the good blood pressure control. Thank you.
Thank you, doctor, for highlighting the critical role of exercise in managing hypertension. Your advice will help patients incorporate the right physical activities into their routines and stay on track to get to goal with their blood pressure targets.